Hello everyone. Myself, Dr. Paritosh Baghel, consultant physician attached to SL Raheja Hospital Fortis Associate. Well, as part of the awareness program, what we are doing today, I'm going to talk on a topic called as vector-borne monsoon diseases, and that includes information about malaria, dengue, chikungunya, and leptospirosis. So, before we begin, as we know, monsoons are the season which bring a lot of relief. From the heat, it's a pleasant weather, but everything is not just so rosy about monsoons because along with monsoons, there are many diseases which become very common, and these diseases are spread by some or the other organisms. So that is why we are going to talk about vector borne diseases. So what are vectors? Vectors ka kya matlab hai? Well, vectors by definition are those organisms which transmit an infection from one person to another. For example, mosquitoes, flies, ticks. These are some of the vectors which can cause infection from one person to another. And during monsoon season, they become very common. Because of the monsoon season, the incidence of these infections become high. Then breeding for mosquitoes is increased, and hence we see a lot of mosquitoes and mosquito-borne diseases. So there are other vectors also, as you can see, which can be labeled as non-living vectors. For example, for respiratory infections, which is very common in monsoons. The vectors are generally the non-living objects like door handles, knobs, and where a person who's got an infection, he accidentally touches the knobs and handles, and or any other item, and so the virus or the organism remains on that surface, and then another person who touches it, the same object which contains those virus, and then you touch your hand to your nose and you get infected. So these are vector-borne diseases. So vectors are objects or organisms which help in transmitting the disease from one person to another. And the very common vectors which we see in this season are mosquitoes and flies. Now we are going to discuss about malaria, dengue, chikungunya, and leptospirosis. As you can see here, out of these four diseases, three diseases, malaria, dengue, and chikungunya, are spread through the bite of mosquitoes. So mosquitoes are a very important vector for these three diseases. Let us first talk about malaria. Very common disease, very common in our country, and very common during this season because the breeding of mosquitoes takes place during monsoons, and hence the chances of getting malaria infection is very high. Now, how to identify who causes malaria? The questions which come to our mind and one should be aware about. Malaria, what is malaria? How is it caused? What are the symptoms? How to identify it? And how to treat it? What should one do? So, well, malaria is a parasitic organism. It is a parasite which is transmitted through the bite of a mosquito, and the mosquito which commonly causes malaria is a female Anopheles mosquito, which generally breeds in water which is stale water and which is running water. It does not breed in the houses, but it breeds in other places. For example, stagnant water which is lying outside in ponds or where there are collection of water, dirty water. That is where this malaria, this Anopheles mosquito breeds. And how does it transmit? If any person has got malaria, if the mosquito bites that person who's got malaria, it takes those parasites into his body, and when the same mosquito bites someone else, that is where it transmits the parasite, and the next person gets the disease. This is very common. There are a lot of epidemics happening because of this. What are the symptoms of malaria? It is a very common disease, a very, very important disease in terms of health-wise because it can be fatal. It can cause very severe illness as well. People have died because of malaria. In fact, the number of patients who die every year in the world with malaria, almost every day around 1,200 patients die. That is the statistics. What are the different types of malaria? Well, if we classify them, there are four different types of malaria which we generally see in our country. It is Plasmodium falciparum malaria, which is the most severe form of malaria which one can get. Vivax malaria, which is more common, less chances of complications, but if not treated on time, it can definitely cause severe complications among all age groups. Third malaria is Plasmodium ovale and Plasmodium malariae, which is less common in our country. The most common type of malaria which generally we see in our country is Plasmodium vivax, spread through mosquitoes. As I told you, the symptoms of malaria are generally non-specific to begin with. How do I know that I've got malaria? How will I get to know that whether I've got malaria? Yes, you start with fever. Generally it is fever with chills. You start fever, you get fever, you may get chills with it. There could be headache, there could be body ache, there could be so many other symptoms. You may feel nauseous, vomiting, there could be abdominal pain. All those things can be because of malaria. They are not very specific for malaria, but yes, if you are living in a city, and during this season when there are multiple cases around you, the possibility of malaria is there. In our practice, whenever we see a patient who's got these kind of symptoms in a setting, especially in monsoon setting, one should think about malaria, that this could be one of the reasons. What are the complications which are associated with malaria? Well, malaria could be a small mild infection. It may not be very serious. If you have a good immunity and all that, probably you will have a milder infection. But in people who are elderly, in people who are in the young age group, and people who are pregnant, malaria can take a severe turn. Falciparum malaria being the most dangerous form of malaria which one could get. How to identify it? Well, to identify malaria, one should, if you get symptoms of fever with chills, the most important thing is to get yourself tested. A simple blood test can identify malaria by doing a CBC, by doing a malarial parasite antigen test, or you can do a peripheral smear for malarial parasite. In this, you would be identifying the virus, the parasite, the malarial parasite, and the chances of detecting this parasite become more if the test has been sent during that episode of fever. If the test is sent during fever, there are high chances that the lab would find out the malarial parasite and identify it. Although let me tell you that the test is not 100% sensitive. It may happen that you may have symptoms of fever with chills and malaria, and the test may still turn out to be negative. So be cautious not to think that this could not be malaria. Start the treatment. Consult a doctor if you have symptoms of fever, chills, body ache, headache, and a CBC shows that there is slight thrombocytopenia, the platelets are little low. Possibility of malaria is there. And especially if you're elderly, if you're immunocompromised in terms of diabetes, hypertension, or if you're pregnant, then you should take it more seriously and investigate it further. What are the treatments available? Well, the most important before any treatment is the prevention. So prevention of these infections, especially malaria and those infections which are spread by mosquito or by any other vector, is to do preventive measures where you have to use complete, wear full sleeves clothes, avoid mosquito bites, prevent the breeding ground of these vectors. Treatment wise, well, the common drug which is available now, is basically based with artemether lumefantrine combination, which is easily available on the prescription of a doctor. It's a simple course of drug, and once you complete the course, most of the times you are free of this disease. But one should remember the complications, when to identify, when to know that this could land up in hospitalization. The warning signs which one should understand for with malaria is if you develop breathlessness, if you develop low blood sugar, if you develop altered sensory in terms of the hosh, if you are feeling talking irrelevant, or there is excessive sleepiness, if there is a lot of vomiting, nausea, you're not able to maintain your blood pressure, if there is bleeding from anywhere, or if in the blood test you find that kidney function is deranged or liver function is deranged, then these are warning signs, and one should immediately get admitted if they have any of these symptoms, which indicates an IV therapy and a hospitalization in a hospital. As I said, this disease is preventable, and preventive measures go a long way in preventing malaria. The next disease which I would like to talk about is dengue. Again, dengue is a vector-borne disease. The most important vector which is there is again a mosquito, but it is a different type of mosquito which causes dengue. It is the Aedes aegypti mosquito, which is in lay term also called as a tiger mosquito. Now, tiger mosquito is different from Anopheles mosquito, and this is the same mosquito which causes chikungunya as well. It is called a tiger mosquito because when you look at this mosquito, it will have stripes on its body, and it generally breeds in fresh water especially which is water which is discarded in pots or which is remaining in your household. So most of the times the dengue, as you can see, dengue infections are common where there is a lot of stagnant water around, especially if you are living in an area where there is some construction happening. There is a lot of water which is stagnated, or there is a discarded tire or discarded pots which are there, and post rains there is a lot of collection of water in that, and that is not cleaned or not thrown away. That is a perfect ground for these mosquitoes to breed. It is called tiger mosquito, very easily identifiable. These mosquitoes generally bite in the early evening time, not in the night, early evening and early morning times. Dengue is a very serious disease. It can cause death, and in fact, it is caused by a virus which belongs to the Flaviviridae genus. And there are four different types of dengue viruses which are there. And it has been known that many a times that dengue infection can be mild, but when it becomes serious, it becomes a very very difficult situation to control. What are the symptoms of dengue? Again, the symptoms are very non-specific. The patient presents with fever, with body ache, chills. Severe body ache is the classical picture of dengue. The other name for dengue fever is also is break bone fever. It is called break bone fever because when it causes fever, and it causes so much of severe body pain that as if somebody is breaking the bones. So that is why it is also called as break bone fever. The classical symptom being fever, severe body ache, headache, nausea, vomiting. The patient may deteriorate and develop into a dengue hemorrhagic shock syndrome, where a person may become very serious in terms of he may bleed from anywhere because of the low platelets, he may develop low blood pressure, he may develop renal failure, he may develop respiratory dysfunction. These are all serious complications associated with dengue. How do we identify? If you have these symptoms, if there is a clustering of cases in and around your area, very much possibility that you should do investigation to find out whether this is dengue, whether this is malaria. It can be tested by a simple blood test which tests for dengue virus in our body, the antigen, as well as we cannot see the virus, but the antigen testing or the antibody testing like dengue NS1, dengue IgG, dengue IgM, they will identify the dengue virus. Very classical finding on a blood test is the low platelets, low WBC count. If there are low platelets, if there is fever with chills, there is severe body pain, possibility of a dengue is there. Rash appears after 4 or 5 days. There could be a rash on the body. Generally, if the disease is mild, it resolves within the next 5 to 10 days. The platelets keep on dropping for the initial 4 to 5 days, and then once the fever breaks, there is an improvement in the platelets that indicates recovery. Also, the stopping of fever indicates recovery. At the same time, certain parameters like the liver function also start improving. There are chances, and dengue can cause infection to the liver as well. It can affect the liver, it can affect the kidneys, it can affect the brain, it can affect the lungs. And if it goes into a severe form of dengue hemorrhagic shock syndrome, the chances of the mortality is very, very high despite optimum treatment. What is the specific treatment for dengue? Well, as we have treatment for malaria, there are anti-malarial drugs. There is no specific treatment for dengue. What is most important is early identification and treatment with supportive care in terms of to take care of the fever, to hydrate the patient, because in dengue, the patient can deteriorate very fast. So early identification, early treatment in the form of IV fluids, management of complications which are occurring helps in treating those patients. Also, if you have got dengue once and if you again repeatedly get dengue, then the chances of developing a severe disease is very high. Similarly, prevention like for malaria, similarly, those similar guidelines follow for dengue as well. The preventive methods include preventing the mosquito bites, wearing full sleeves coats, use of mosquito nets has shown that the incidence of mosquito-borne diseases become less. Also, make sure that the breeding grounds of mosquitoes are not there in your vicinity. The third disease, which is chikungunya, again it's a mosquito-borne disease, and it has been caused by the same mosquito which transmits dengue. Well, chikungunya is not a fatal disease, but it can be very debilitating in terms of that it may cause loss of function in terms of the joint pain which you get. The symptoms लक्षण चिकनगुनिया के लक्षण भी यही हैं. Similarly, non-specific symptoms of fever, there could be severe headache, severe body ache, and the most clinching feature of chikungunya is the involvement of joints, where the patient may complain that he is having a lot of joint pain. All the joints are getting painful, they are swollen, and the fever is associated with it. This pain in the joints can remain for 6 months also. Although the fever may not be there, but there could be a possibility that the patient may complain of joint pain, multiple joint pain for a long period of time. It is again caused by a virus. Treatment, investigation, again a simple blood test can identify chikungunya. And once you get chikungunya, it's not a fatal disease, but one has to be very careful. If you may develop arthritis, or you may develop a joint pain for a longer period of time, so you may have to take symptomatic treatment for that for a longer period of time. Treatment, again, no specific treatment for chikungunya. There is no specific drug against chikungunya. It is more of a symptomatic treatment which one should do. Hydration, symptomatic treatment in terms of paracetamol or painkillers along with IV fluids help in a long way to take care of chikungunya. No long-term complications associated with chikungunya. The last disease which I'm going to talk about is leptospirosis. Very common. We had a leptospirosis epidemic in Mumbai in the year 2005-2006. It was after the flooding in monsoon in Mumbai. Leptospirosis, not a very common disease, but it is a disease of the city and poor hygienic conditions and poor sanitation. It is caused by a spirochete called Leptospira interrogans, and it is an organism which is spread mainly through the sewer mice, the rats which breed in the sewers, and that is why it is also a vector-borne disease. And the most important factor which one should understand in the spread of leptospirosis is, why did this happen during the monsoon flooding? Because after the flooding, the sewers were flooded. There were rats which were living in there. They had come out and they spread this organism, or spread this infection by passing those organisms in the water, in the dirty water, in their urine. And when you come in contact with this dirty water, for example, if I am traveling somewhere, and while traveling, I am traveling through this dirty, muddy water, which is infested with this organism where the rats had been living. And if there is a cut on the feet, there are many microscopic cuts which we don't even know. The organisms enters our body through that, and that is how you get infected. So again, the vector which is important is rats. And the most important factor which is there in most of our patients who get leptospirosis is the history of walking in dirty, muddy, flooded water. If that is a history and patient gets fever in this season, I definitely think about leptospirosis. That is one of the things which one should keep in mind. And how do you treat leptospirosis? How do you identify? What are the symptoms? Well, the symptoms, again, after a brief history of traveling in a muddied water or in a dirty water, after around 4 to 5 days, the patient starts developing fever, body ache, headache. Again, they start with fever, non-specific symptoms. But it can turn into a severe disease where the liver involvement is very common. There could be episodes of bleeding, jaundice, and liver failure. So any patient who comes with history of traveling or walking in a muddy water with fever, with involvement of jaundice, high possibility that this could be leptospirosis. How do I identify it? Again, if you have these symptoms, if you have this history, get yourself tested by doing a blood test. A simple blood test can identify whether you have got leptospirosis. Treatment, again, there are treatment available. If you take the treatment right away, the chances of recovery is good. But in case of severe disease, the chances of death increases if the treatment is delayed. Early identification by doing a blood test and starting therapy is the most important factor in treatment of leptospirosis. What are the complications associated with leptospirosis? It can lead to jaundice, it can lead to liver failure, it can lead to bleeding. How do I prevent? Again, prevention, most important thing is to prevent going out into muddy water. If there is a muddy water, if there is a pooling of water and where you have to cross it, you can avoid it. It's better. Otherwise, make sure that you are wearing long boots and you don't come into contact with this dirty water. That is the way you can avoid it. And sanitation, important, which is very, very important in terms of as an epidemic perspective for the city. Sanitation, prevention of accumulation of water prevents leptospirosis. These are the vector-borne diseases, and the most important thing which one should remember is that these diseases can be easily controlled by preventing the vector, by taking care of the vector. The link between an infection from one person to another is that link, is that vector. The mosquito, the fly, or the rat, these are the vectors. If vector control is taken care, most of the times these infections can be prevented. What are the other things which one should take care to prevent such monsoon diseases? Is to maintain a good immunity. Now there is no test for immunity, but one can be sure of maintaining a good immunity if he has a good lifestyle in terms of daily regular exercise, in terms of good adequate nutritious diet, a balanced diet, consumption of fruits and vegetables more than the fat and a lot of carbohydrates which we have. So eating a healthy food, maintaining a healthy lifestyle by doing regular exercises, keeping eating on time, these are the things which help in building up the immunity. Preventive methods in terms of prevention of mosquito bites, prevention of spread of disease, in terms of that if you are sick, you make sure that you are not going to your work, you are maintaining a distance with people so that you don't be a reason for spread of infections. Avoid going into muddy water, especially flooded water. Chances of getting leptospirosis are very high. Fourth, if you are having some underlying disease like diabetes, hypertension, or anything, make sure that you are maintained your sugars very well. Make sure that you are taking your medicines regularly. Make sure that you are tested yourself properly. And in case, unfortunately, even despite all these preventive methods, if you catch the disease, make sure that you get it diagnosed very early and you start the treatment by consultation with a doctor. Ignorance and not taking proper care most of the times leads to complications with these diseases. Thank you so much.